Okay. Hi, everyone. Good morning. Thank you so much for coming and joining the colloquium today. And for those of you who have to be here, thank you for letting us come and talk to you today about youth-adult partnerships. And thank you to the Commission for recognizing today's important day, National Youth HIV/AIDS Awareness Day. Daniel and I are really excited to be here today to be talking to you about kind of the importance of engaging youth and really partnering with youth in our HIV prevention and care work. So we're going to go over some national data about how HIV is affecting youth. We're going to discuss barriers to engagement for youth across the prevention and care continuums. But our take-home message today is really going to be about, and this is what we're really going to be focusing most of our presentation on, is how can we better, as adult allies, partner with youth communities, not just in our agency work, but also in our community and community planning work as well. So just a little bit about who we are. Daniel and I are from the SIP Center, or the Center for Strengthening Youth Prevention Paradigms, and we're a capacity building assistance provider based out of the Division of Adolescent and Young Adult Medicine at Children's Hospital Los Angeles. And we provide training and technical assistance to communities, agencies, systems of care, coalitions that are working towards addressing the social determinants of health that create health inequities among youth communities, including the HIV epidemic for young people. And just a quick shout out to our National Advisory Board that vet our materials and make sure that our services are culturally competent and appropriate.
Great, and so our learning objectives, sorry, I'm trying to fix the mic. I do not get along with mics. So hopefully by the end of this presentation, we'll all have a better understanding of what social determinants of health means. We'll understand how that's connected to youth communities and impacting them around HIV access. Access to services and treatment. We'll also talk about some concepts around like adultism and how that could be a barrier to effectively accessing services. And then we'll identify some strategies that the Commission can take, as well as individual members here in our audience as agencies that can better support youth leadership in HIV prevention and care.
So before we get into the main part of our presentation, we just wanted to set some context in regards to the national epidemic among young people to put our talk today into perspective about why youth need to be engaged in the decision-making around our HIV prevention and care services, and why it's increasingly important for us to partner with youth in this process. So just some statistics. Youth continue to be significantly affected by HIV in the United States. About 60% of young people with HIV do not know their status. New infections continue to be high among youth communities, and in particular, young gay and bisexual men and transgender youth of color. Data shows that young gay and bisexual men in particular, and in particular Black and African American young gay and bisexual men, were the group with the highest increase in incidence in 2006 through 2009. And of course, because of the way data is collected, transgender people often get lost in this data, but as we know, often transgender women are incorrectly grouped with gay and bisexual men in terms of their categories. So while there's little national data to confirm this, though it's clear that transgender people are a highly affected population as well. Young people are also less likely than their adult counterparts to be engaged in care, retained in care, or have their virus in check. While we know that kind of infections are on the rise among young people, in particular among young gay and bisexual men and transgender youth, and among youth of color, it's clear that youth are one of the groups most impacted by HIV. However, I think we can all agree that usually youth don't have a say in terms of strategic directions or larger trends in HIV prevention and care. Often, they're very much not at the table. Some current trends that might have particular implications for youth are shifts away from prevention with HIV-negative individuals, the increase of services focused on individualized care, and moving away from care that's focused on the specific needs of communities, including youth. And then, of course, the consistent movement away from more comprehensive, holistic, or structural approaches that address the social determinants of health that are so important. This might look kind of familiar to some people. It's an adaptation of the Gardner Cascade. And what this really highlights is we need to be engaging youth across the continuum of prevention and care, and this is it kind of highlights the continuum of care and how we lose folks through each stage. Ideally, every HIV positive person knows their status, they're linked and retained to care, they're prescribed antiretroviral therapy, and they reach viral suppression, for their own health and for the health of others. But unfortunately, as this Gardner cascade shows us, and the dark green version is the adult cascade that people might be familiar with. Really, only 82% of the population in the United States, of the adult population in the United States that are positive, know that they're positive. And we see a drop off at each stage along the continuum and have only 25% of adults virally suppressed. Since national data wasn't available to look at what the cascade would look like for youth, we decided to make one up ourselves. Using some, extrapolating from some data. So since we know that 60% of HIV positive youth do not know their status, for youth, if the youth cascade did exist, it would really start at around 40%. So already half of what we see with adults. So for youth, the cascade would start at 41%, know their status, and from there we can extrapolate that maybe perhaps only 12% would be virally suppressed. And of course, this cascade doesn't really acknowledge the complementary kind of other side of HIV prevention and care. Some of you might have seen the new statement from the Treatment Action Group that's advocating for a HIV prevention continuum, which would include linkage and retention to primary care services like testing, screening, health literacy, peer support. So not to forget that. But kind of in both of those continuums, we need to really be continuing to engage our young people throughout the process and partnering with them to figure out why are we seeing these huge drop-offs and how can we problem solve together, addressing some of those barriers. And some of those are probably around the social determinants of health, which is what Daniel's going to talk about right now.
So social determinants of health, it's definitely something that I'm sure a lot of us are familiar with. And we kind of have a nice word cloud just to give us something else to look at than a long sentence definition. But the long sentence definition is the conditions and circumstances into which people are born, grow, live, work, socialize, and form relationships, and the systems that are in place to deal with health and wellness. So under this definition, basically, everything is kind of social determinants of health, right? Is having an impact on individual people's well-being and access to healthcare. And so, we have some examples that we'll get into in a little bit. And to kind of help us just conceptualize it, right? Because it could feel a little overwhelming to think about what is everything that's tracking in people's lives. We have this lovely visual to help us kind of sort and filter some of the different kind of groups of conditions that are impacting people. So at our first level, right, we have biology and genetics and identity. That's kind of just our individual person, and that those things definitely do have an impact on our health, but they're not social determinants of health. At the second level, we start getting into actual social determinants, and that's community networks. And that could be anything from our family, peer networks, the people in our lives, right? The communities, faith communities we might be part of or not part of, and just those kinds of connections that we might or might not have and how that might impact our health. At the third level, we have our living and working conditions, and that's exactly what it sounds like. It's like, how do we live? How do we work? Do we live in a community where there's a lot of environmental pollution? Do we have to take the bus really far to get to go see a doctor? Do we work a job that doesn't provide us adequate health care? Do we have a job that doesn't pay us enough money? Those kinds of issues are all located at this third level. And then at our fourth level, we have kind of our more kind of nebulous issues, right? That's the socioeconomics and environment, and that's more things like racism, stigma, transphobia, homophobia, kind of those isms and phobias that are a little harder to name at times, but are definitely operating at that level, but really are manifesting at every single level, right? So to kind of help us break this down a little bit and see how it impacts youth, we have some case studies that we wanted to kind of walk you through. And our first case study is Jasmine. Jasmine is a 21-year-old multiracial transgender woman. She took a 45-minute bus ride to get to an agency for an HIV test today. Jasmine has visited this agency before, and Jasmine tests negative for HIV. So in kind of the post kind of counseling session, she asked the tester about PrEP because it's something that she's been hearing a lot about. The tester tells Jasmine that PrEP wouldn't be a good fit for her because it takes a lot of responsibility to take it correctly, and Jasmine probably would be overwhelmed with all the dosing requirements and taking it on a daily basis. So Jasmine, right, she feels disempowered and leaves without any further information, so she's not any more clear on what PrEP is, why it would be hard for her to manage, what exactly it'll do, how it helps her increase her options for keeping herself negative. She just doesn't know anything. So she decides not to come back to this agency, right? Since who would want to go back if you got treated in a not so good way? So we have kind of some social determinants that we teased out, but there is a lot. I mean, we could talk about Jasmine's case for hours probably. So at the community networks, what we saw happening here was that there was some provider assumptions about her maturity level because she was 21, right? So there were some assumptions that her age kind of let us know what she's capable of managing, what she's not capable of managing, right? There was also just incomplete information about PrEP given to this person who might be a good candidate for it. We don't know. At the living and working conditions level, we kind of saw that, right, Jasmine depends on public transit, which, is getting better in LA, but it's not the best, right? A 45-minute bus ride is not the funnest thing to have to do if you're trying to go see a provider. And we also figured out that there's no nearby service provider to where she lives that's also trans-affirming, right? So that's kind of other parts of her identity are coming in. And then at the socioeconomic and environment level, we saw adultism, transphobia, and racism. And adultism is something we're going to talk about a little bit later, so if you're not too familiar with it, you will be. So our next case study is Michael. And Michael is a 17-year-old Latino gay cisgender youth who is also HIV positive. Michael was diagnosed 6 months ago and saw a doctor initially to get treatment. Since then, he has stopped talking with his family, moved in with his boyfriend, and started working. He no longer is going to school and hasn't seen his doctor in 3 months. A case manager at the clinic calls him to see why he stopped seeing his doctor. And Michael talks to the case manager and shares that the doctor made him feel bad. That kind of did some shaming because he wasn't taking his medication all the time. And the doctor threatened Michael with talking to his parents if he didn't do better in taking his medication, right? So a very kind of punitive approach. And so, oh, sure, yeah. So cisgender, it's a term that's related to transgender, so it's another form of gender identity. And it's generally used for folks whose sex assigned at birth and gender identity match up. So for example, I identify as a cisgender person because my sex assigned at birth was male and my gender identity is of man. So thank you for that question. So our second case study, right, with Michael. So in terms of social determinants that we see operating at this level, again, we see some provider assumptions about maturity level, right? That because Michael's 17, the doctor seemed to make some assumptions about why he wasn't taking his medication. We see that there's some family rejection, right, that caused Michael to move out of the house, right, and lead to some instability. We also see that the provider was ignoring the minor consent law in California, which would make it illegal for the doctor to call Michael's parents and kind of threaten him that way. In terms of living and working conditions, we see that there's a lot of housing instability, right, and that he's dropped out of school. And so we're not clear what kind of work he's doing, if that's like a viable career path. We're just not really sure if it provides healthcare. So those are issues that are happening for him. And then in socioeconomic and environment, again, we see some adultism, we see some HIV stigma, and some homophobia, right? So all those kind of are infusing the things that are happening to Michael. And now Mia's gonna kind of walk us into some definitions about youth-adult partnerships.
So we're going to shift we wanted to really just set the context and think about how important it is to really acknowledge social determinants of health, especially when we're working with youth communities. But we're going to shift and we're going to talk a little bit more about the ways that we can better partner with young people, kind of as individuals, but also at the agency and community level. So our definition of youth-adult partnerships is the equitable working relationship in which adults partner with young people to address the issues, policies, programs, and organizations affecting youth. So I think the one part of this definition that we really want to focus on is that idea of equitable working relationship. So we're recognizing that both youth and adults are contributing to something in a professional, ongoing, mutual, respectful way. It's focusing on really challenging that unequal power that exists between youth and adults. And it's not about adults creating the parameters of a project and youth are obeying, right? It's focused on having both youth and adults contributing in their own ways to a partnership. And mostly this definition is really about challenging the way that society thinks of and treats young people. It's not about just consulting with them every once in a while, or maybe working on their behalf because we have an idea of what we think is best for young people, but really truly partnering with them to address the issues that affect them. So we need to work with them, and change the way that we kind of check ourselves and work with them as good adult allies kind of on the individual one-on-one basis. But we really also need to build youth-adult partnerships into the structures of our agencies, and have good agency buy-in, and have it be part of our community processes, and really across society as well. So just a couple of points of what makes a good, effective youth-adult partnership. Effective partnerships really always acknowledge the fundamental societal power imbalance that exists between youth and adults. And that's really kind of the first step. Society really, and adults really need to be honest and transparent about this, that this dynamic exists in our world. Society really treats youth as, they're not ready yet. They don't have the mental capacity to exercise power over their own lives. And that's not true. We need to, effective partnerships also authentically share decision-making authority between youth and adults. So to make a true youth-adult partnerships, that means adults need to give up some power, which can be a little bit scary, but really just requires a degree of transparency and intentionality when working and partnering with young people. And kind of let go of the way that we're usually doing things, where adults have the control and we bring youth into the equation maybe later after all the decisions have been made. Effective partnerships also value the complementary contribution of each participant. And that doesn't mean that, adults kind of create a space for youth and let them take over, right? It's about adults also sharing their skills and knowledge and abilities. And really acknowledging that both youth and adults have valuable skills, experiences, ideas to share, and a good partnership will make room for both to be able to kind of share those ideas, experiences, skills, and would be in the ideal situation, be empowering to both as well. Effective partnerships also should offer benefits to youth, adults, agencies, communities. It might be easy to see what maybe youth might get out of youth-adult partnerships in terms of maybe mentoring, being empowered, learning career skills. But it's harder to see how these partnerships might affect adults or agencies or communities. But there are tangible benefits there, like practicing communication skills, adults learning to be more flexible, having more effective programming, and really impacting youth at a deeper level. Effective partnerships are also guided by ongoing reflection and evaluation. This doesn't mean you're necessarily evaluating your process with pre- and post-tests. It just means that you're creating a culture where you're open to feedback, and a culture of reflection, really. And being open to really receiving that feedback, not just asking for it, but being ready to receive it from both youth and adults kind of throughout the process. And then effective youth-adult partnerships also require institutional commitment and change. Youth-adult partnerships works best when kind of the agency or the larger community process really values this concept. And when that doesn't happen, when an agency as a whole or a community process doesn't take youth-adult partnerships into its core philosophy, that really leads to some burnout for individuals who are kind of trying to partner with youth on a more individual basis, and also for youth as well. And I think one of the biggest barriers, which kind of we hinted at with the social determinants of health case studies, that's a barrier for youth-adult partnerships, is adultism. An ism that's often, that's one of the most normalized of all the isms and obias, and we'll talk a little bit more about what that is.
And so adultism, right, is the belief system which views adults as the rightful holders of power in society and its institutions. So this system controls how youth are treated in all parts of our society and interpersonal relationships between adults and youth, also as well as how youth treat each other. So that's kind of like a big word definition, and we apologize for having so many of them, but we just like defining things. And to kind of break it down, right, so institutions in a society is everything from kind of government, which is kind of the setting we're at today, but it's also like our agencies, service providers, schools, right, families, all those kinds of things that make up our society, right? We definitely do see adultism and young people treated in really similar ways. And it's also important to remember that, it also impacts us how as we individuals act with youth and how youth support each other, but it's also much bigger than just that. So there's room for intervention definitely at our individual levels and how we act as adults supporting youth, but definitely in our agencies, which are youth adult-led, and how we can maybe strengthen partnerships at that level. And so to kind of make this a little bit more real, we have some examples that we have seen that youth have shared with us that kind of make it a little more real. So the first one is that at a clinic, the staff serving, there's a clinic that serves both adults and youth, and the staff tend to make a lot of negative assumptions about youth. So if youth are running late, maybe there's assumptions that, oh, you forgot, as opposed to maybe the adults, there's an assumption, oh, maybe your car broke down. So there's just some kind of hidden bias there. Youth are never discussed by a community planning group when prioritizing resources, so that can happen. Young adult staff at an agency are frequently asked to represent the views of youth clients, so kind of tokenizing them and being like, well, you look young, so you probably know what actual youth clients are going through, so you speak for them. An HIV prevention agency never tests youth under age 18 because there's just like, oh, well, that's not where the epidemic is, so that's not a priority, so let's not waste our resources there. The instructions on medication for HIV-positive youth are delivered in a really inaccessible manner, so there's not an effort to kind of translate it and make it accessible for whatever experience and concepts that youth might understand. And then our last one is a community coalition might invite a panel of youth to speak on their experiences, but not prepare them beforehand and not prepare the adults to kind of be good allies. They'll just be like, here's some seats, speak, all right, thank you, we'll clap, thanks, goodbye. So those are just some examples that we see happening a lot that kind of are missed opportunities, and that's why we wanted to highlight them. So some more definitions, and we've kind of thrown this word a little bit around today. Adult ally, and that's an adult who has committed themselves to using their societal privileges and power to advocate with youth in order for youth to have greater power and responsibility over their own lives in all contexts. An adult ally continuously works to understand the best ways to support youth self-efficacy and maintains appropriate boundaries. And we really like this definition because it really kind of keeps the focus on like what's the whole point of this, right? So it's not just to make us feel better that we're not being rude or disrespectful to youth. It's really about building young people's capacity to make good, healthy life choices. And youth are living today. They're not just future leaders who at some point are going to have to know how to make good decisions. They actually have to make good decisions for themselves today. And if we don't give them the space and the mentoring to do that, we're really doing them a disservice. And so we have some skills that we kind of recommend. Sorry. And we kind of broke them down into two categories. So one is some skills to practice kind of with yourself, so kind of internally, and then some skills to practice with other folks. And so with yourself, being self-reflective and humble, we have just found that that's really critical, is to kind of just admit that we're all going to make mistakes, that we all kind of grew up in a society that is adultist, and our default assumption is to view youth in a way that is inherently disempowering to them. And so just kind of own that and just be like humble about it and be open to kind of watching how those assumptions and biases might be playing out. No one's a villain if you make an adultist comment or make an adultist assumption. It's just about how do we correct the behavior and stop it, from disempowering our young people. Another one is maintaining high expectations. I think a lot of times we tend to just write youth off, and especially youth who we might work with who have a lot of different issues going on in their lives. We just tend to be like, well, that was good enough, okay. And I think that we really do them a disservice when not expecting the best out of them that's possible, right? Understanding their context and giving them support to reach those goals, but really not just being like, it's okay, you have this job, you don't have to go to college, it's okay. Like, I think really challenging, what are youth capable of? What are they able to do with the right support? And I think if we do that, we'll often be very surprised. We also think it's really important to recognize youth as knowledgeable participants. Our society tends to see youth as just kind of being dumb and kind of not very smart, not very full of insight because they're not older. And I think that's a really missed opportunity where youth have different kind of wisdom and knowledge to bring to the table if, again, we create room for it and we legitimize it and validate it. And again, going back to just acknowledging the full context of youth's lives, I think sometimes we forget that just because we see them in this one kind of relationship and this one interaction, but it's important to remember maybe this week our group is not the most important thing in their lives, and that's okay. And that doesn't mean that they're not coming because they're irresponsible. It just means they're actually maybe being really responsible and prioritizing and managing their time better than we think they should. And the last one is just setting and maintain boundaries. I think that's important for anyone kind of doing work with anyone. It's just really important to maintain good boundaries for ourselves and not kind of over-involve ourselves emotionally, and that could be really difficult. But also not to try to like save every single youth, and that kind of paternalistic way. And so some skills that practice with other folks, right, are just addressing power dynamics. I think in our society it can be difficult to just name some things when they're happening, but it's okay to just say, oh, I think we're kind of being adultists in the room right now. Let's just sit with that for a little bit and see what we want to do with it. I think it's also just important to be transparent. I think a lot of times we tend to shield youth from just what's going on, like, oh, there's budget cuts coming. Whoops, rather than being like, okay, this is what happened, this is the process that went into it, this is the impact that's gonna happen. What do you all think we should do to kind of manage these cuts, right? It's just, we tend to think youth are really vulnerable and can't handle some things when they can with the right support. It's also important to build trust and rapport. Again, that's a critical skill for anyone working with young people, especially young people who have a lot of different traumas that they might have experienced. So it's really important to build that trust and accountability. This last one's one of my favorite, which is educate other adults. And I think it might be really good for us to be a good adult ally, to have a good understanding, to individually do some good practice. But if we're not kind of reaching around us and trying to have an impact, we're kind of missing, we're kind of missing part of the job of being an ally, which is to kind of change our peers who might also hold that kind of identity of privilege and power. So it's important that we also educate other adults. We're here having this conversation. I hope you all go back to your agencies and continue this conversation with folks who might not have been here today. Building organizational capacity is really important. It's like creating time to maybe bring some trainings in, to maybe have discussions and talk about how as an agency are we going to systematically have youth input? Is it the form of creating a youth advisory board? Is it having like feedback sessions? But how are we going to create some permanent mechanisms that'll improve our practices as an agency? It's also important to treat youth as unique individuals. I think sometimes when we've been doing this work for a while, it can be easy to be like, oh, okay, let me get some risk factors from you, and then I can make all these assumptions about your life and who you are and how you ended up there. But I think we all know that that's not the best way to treat anyone, and I know that when people have done that to me for other identities, it doesn't feel very good, right? And if anything, it becomes a barrier to my care. So it's something to think about is how do we kind of challenge and leave behind assumptions that we're bringing into the room when we're working with young people. And it's also important to invest in leadership development. I think opportunities today, like the young people who spoke earlier, I think that they took on themselves. It's really important that as agencies we support that and fund that if we can, but to give them like meaningful guidance. How do you do public commentary? How do you do presentations? What are budgets? What's a planning commission? Breaking down these concepts in a way so that they can kind of be conversant and literate and be able to meaningfully interact with what we're talking about, not just kind of bringing them in on a tokenizing basis, like, okay, we wanted the youth faces this month. Thank you for coming. And one of our last 2 points is to just create space for youth to process internalized adultism, right? So a lot of times we see young people tearing each other down, kind of not listening to each other, but if an adult walks in the room, then they'll listen to that person. But just creating a space for them to talk about, why is that? Why do we not listen to each other? Why do we not support each other? Why do we need someone who's older than us to kind of get us to listen? And the last one is just about accessibility, and that's just thinking about things like time, right? What time do things meet? What time does it end? How close is it to transportation, right? All those things that I think we're used to thinking about for maybe prevention groups or treatment, but not necessarily thinking about for decision making, right? Is it accessible? Is the language we're using accessible? Is the format accessible? So that was a lot of talking. And so now we want to move into kind of the more proactive pieces. What can we do to reduce some of these barriers more at an agency level?
All right, so we love structural change at the SIP Center. And so we want to really just talk about what are ways that we could make sure that we're really building an infrastructure where youth adult partnerships are being successful. And we always look at things from a structural change perspective to really focus on sustainability and to kind of make change a little bit more manageable and achievable by breaking it down into kind of smaller groups. So we define structural change, and people who are involved with Connect to Protect Los Angeles Coalition are familiar with this definition that we stole. A new or modified practice, program, or policy that can be sustained over time and strengthens youth-adult partnerships. So these are kind of really just a definition to be able to make structural change a little bit more manageable and achievable. Structural change really, obviously focusing on strengthening youth and adult partnerships and really focused on being sustainable, meaning that the person who is impacting the change after they leave, the change still continues. But a really great way of thinking about making change is thinking about it in terms of practice, program, or policy. So either simply, changing the way you do things, like changing a practice to make sure that you're always incorporating feedback or implementing some sort of feedback mechanism when making decisions. A program change, maybe creating making a youth advisory board. Or at the most sustainable level, some sort of policy change. For example, building it into your written guidelines that whenever decisions are made, they need to first consult with the youth advisory board. So we wanted to give some examples of potential structural changes that can be implemented at the agency level. Some of these might be things that you could accomplish. Some of them might not even be feasible necessarily for your agency, but we wanted to just give a breadth of different examples for people to sit with. So some structural changes to consider might be adding youth to your agency's board of directors, like having a youth seat, creating programs that transition youth clients into paid staff, hiring youth as staff, providing ongoing training for young adult staff, requiring regular training for all staff at your agency on youth adult partnerships, perhaps creating a style guide for staff on adultist terms to avoid when creating communication materials like kids or future leaders. I think we saw today that youth are leaders today. And creating a youth advisory board with authentic power. And another great thing to consider also and another great venue in order to really implement youth adult partnerships is through youth-driven design. Or really just involving youth in the planning, development, and distribution of outreach or educational materials that are targeting youth. This is a great way to ensure that the materials would be effective and reach their audience, but also provides a great opportunity for project-based youth adult partnerships in practice. Just a couple of more structural changes to consider.
And so these are specifically for the commission that the commission might want to consider. And one of them, the first one is including adultism when just assessing systemic barriers that young people face. I think we're more familiar talking about racism, sexism, transphobia, poverty, and those kinds of other macro issues, but I think it's also important that we foreground adultism when we're talking about what's going on in young people's lives and what might be preventing them from participating in the commission. It's also important to just try to hold regular and accessible feedback sessions with youth. I think sometimes we're always like the door's open, but it's kind of like the door's open to my house at my time. And sometimes we have to kind of go out to someone else's house and be the guest at their time. So just something to think about. And I think it's also thinking about holding the commission meetings at a youth accessible time. I know that folks are busy and that a lot of folks are juggling lots of things, but 9 a.m. is not necessarily the most youth inviting time for lots of different reasons. And I think also the last one is just prioritizing youth needs around prevention and care. And I think that you probably hear that one a lot for lots of different groups. And I think we want to be clear, we're not speaking from kind of like a model of scarcity where we feel like youth have to fight seniors. I think definitely it's about all of our community needs resources. And I think we're all acknowledged that nobody is getting the resources they actually need. But definitely when we talk about youth, not necessarily just dismissing their specific needs for resources just because maybe the numbers don't look the same way as they do for other older populations, but really thinking about what can targeted resources do for young people who are going to be older anyway and get in those groups that we see a lot of numbers for. So
this is kind of our last slide, and we wanted to make sure to save some time for discussion. But we hope that we covered some information that you'll be able to take back to your agencies or maybe that might apply to further discussions here at the Commission. We discussed the impact of HIV on youth communities at the beginning of the presentation, how adultism, among many other social determinants, play a role in how youth can access services in both HIV prevention and care. And hopefully we tried to make the case about why youth cannot be left out about important decisions and really need to partner with adults. And kind of hopefully this presentation provides a call for all of us, and kind of myself included, that we need to work to make sure that youth voices are at the table, and that youth are trained and supported at being at the table as well. And that youth adult partnerships can be sustainably integrated into all of our agencies and also all of our community planning processes. So that's the end of our spiel, but we would love to hear from anyone in the audience or in the Commission if people have thoughts or comments or questions. and then we'll have a couple of slides to wrap up at the end.